Good morning. Welcome, everyone. I'm absolutely thrilled to be here with you as we learn and we connect in the wonderful city of Chicago. Yes. In January, the nurse practitioner community experienced a profound loss with the passing of Dr. Loretta Ford, just weeks after we celebrated her remarkable 104th birthday. Dr. Ford partnered with Dr. Henry K. Silver in 1965 to establish the first nurse practitioner program at the University of Colorado. It was focused on pediatrics. Without her, none of us would be in this room today. The Today Show's Willie Geist recently paid tribute to Dr. Ford in a heartfelt, A Life Well Lived segment. So let's enjoy that segment together as we remember Dr. Ford.
This week we highlight another life well lived. There are nearly 400,000 nurse practitioners working in the United States today. They are nurses with advanced training to care for patients and an essential part of our healthcare system. That critical job was created by a woman named Loretta Ford. In 1965, Dr. Ford, or Lee to the people who knew her, co-founded the first graduate program for nurse practitioners at the University of Colorado. She believed simply nurses were capable of more, that their jobs could be more clinical than administrative. And Loretta knew from experience. Growing up in New Jersey during the Depression, she began working at 16 and got her nursing certificate at 20. Her fiance was killed in combat during World War II, inspiring her to join the U.S. Army Air Forces as a nurse. After the war, she married William Ford, her husband of 67 years. Ford graduated from the University of Colorado with a master's in public health and worked in the state's rural communities doing the work of both a nurse and a doctor. In 1972, she became the first dean of the School of Nursing at the University of Rochester, where she taught and advocated nationally for the role of nurse practitioners in medicine. In 2011, Ford was inducted into the National Women's Hall of Fame.
I have been kicked and kissed, reviled and revered, cursed and credited. Still, what you see is what you get. I have not been Botoxed or detoxed.
Dr. Loretta Ford, the mother of nurse practitioners, died last month at home in Wildwood, Florida. She was 104 years old.
Thank you, Dr. Ford. We strive every day to honor your legacy as a profession. In the spirit of Loretta Ford, NAPNAP's vision is to ensure that all infants, children, adolescents, and young adults receive equitable, high-quality pediatric health care. All children means all children, no matter their race, religion, gender, ethnicity, sexual orientation, country of origin, or socioeconomic status. We are committed to ensuring they all receive the best possible care to live long and healthy lives. According to our mission statement, in addition to optimizing the health and well-being of infants, children, and adolescents, and young adults, we're committed to empowering our community of pediatric experts. NAPNAP boasts 8,000 members, featuring dedicated professionals from every state across the United States, and even a few from other countries. Our members include those in primary care, acute care, and in specialized fields. Some work in academia and research, while others focus on clinical practice. Because we are a national organization, our members represent diverse backgrounds, experiences, and perspectives. We are committed to being a welcoming home for every nurse practitioner who cares for children, regardless of their race, religion, gender, ethnicity, sexual orientation, country of origin, or socioeconomic status. When we say all, we truly mean all. It's this diversity and our resilience that will help us move forward during this uniquely challenging time for our nation and for our profession. I'll be honest, it's not always going to be easy. The sheer number of executive orders, confusing and conflicting messages, and legal challenges that have had an impact on healthcare and scientific discovery require thoughtful but fast-track review and analysis to determine the most effective actions that NAPNAP and our members can take to safeguard children's health and well-being. However, I believe that together we can weather these challenges and can have a positive impact on children's health. I want to assure you that your executive board and national health policy team are communicating on a daily basis and consulting with leaders from other prominent healthcare organizations about ways to stand together to amplify our voice to protect children's healthcare. In this time of uncertainty, our mission, vision, and core values guide our actions. To advocate for children who cannot speak for themselves, to show respect and accountability to you and to our partners in children's health, to commit to diversity, equity, inclusion, and belonging, because again, all means all. To dedicate ourselves to lifelong learning, as you've done by being here in Chicago, to demonstrate innovation in our practice, research, education, and the way that we meet the challenges ahead of us, and to be visionary leaders building castles in the sky and laying a strong foundation beneath them. And finally, to live and work every day with professional integrity and passion for our practice. As we navigate the shifting political landscape, your NAPNAP leaders and federal affairs representatives are actively engaged, meeting every week with coalition partners and congressional leaders to address critical issues that affect you and the care of the children that you're responsible for. In line with our strategic plan, we have publicly joined efforts to oppose the removal of life-saving data from federal websites, to oppose cuts to SNAP and other child nutrition programs, to support Medicaid coverage and enrollment, especially for school-based services and mental health services, and to oppose policies restricting access to equitable, high-quality, evidence-based care for all children. In alignment with our strategic plan, I'm excited to announce that we are forming a partnership with True Merit, formerly known as CGFNS International. This collaboration will foster a new global health initiative to enhance children's health outcomes through advanced nursing care worldwide. This effort is particularly crucial in light of the gaps in global aid left by the current federal administration this year. NAPNAP will continue to evaluate federal and state government statements and policies to identify impactful and actionable strategies that align with our values while protecting our association and its members. We will keep you updated on our actions through email communications and messages through NAPNAP's various channels. To strengthen our advocacy, we invite every single person in this room and our members across the country to act. We're circulating an online petition called Stand Up and Speak Out to express our concerns regarding recent executive orders and policies that will adversely affect pediatric health. We will share this position with congressional offices, as well as agency leaders. You can access and sign the petition using the QR code displayed on the screen behind me. The more individuals who sign this petition, the louder our voice will be. So I encourage you to add your name as we advocate for child health. To strengthen our case when meeting with congressional offices and agency officials regarding how policy changes affect NP practice, education, and research, we need your professional stories. We need to know how this is changing things for you. So please take a few minutes to share your experiences in light of the new policies using the form that we have created. You can find it on our website. It's also been included in recent newsflash and other NAPNAP communications. If you can't find it on the website, it's in an orange bar at the top of the page. I also encourage you to consult with your employer's legal teams if you feel that the ability to provide equitable care is challenged, and to stay informed about health policies affecting your work or engagement with NAPNAP's advocacy efforts. Your voice as a nurse practitioner and a constituent has significant power to influence change through grassroots advocacy. Our Advocacy Center makes it easy for you to introduce yourself and raise awareness to priorities that affect your patients, a way to connect with your elected officials. Our Advocacy Center is updated regularly, and it serves as a platform for you to respond to calls of action regarding specific policy matters. So on behalf of the Executive Board and our national office staff, I thank you for your ongoing commitment to children, their families, and to our broader nurse practitioner community. By standing together, we will continue to stand firm for the health and well-being of all children. Thank you.